5 self-care tips for caregivers of Alzheimer's and dementia patients. Providing full-time care to a family member with Alzheimer's or dementia can be tough. Even if you are not living with the loved one, you may worry or be on edge anytime the phone rings. The responsibility can be overwhelming. You may feel guilty when you are away or feel alienated from family and friends. For this reason, caregiver burnout is a concern for many. To help with the stress, use these 5 self-care tips. Tip number 1. Treat yourself to some free time. When you are a caregiver of someone with dementia or Alzheimer's, making time to focus on yourself can be a problem. However, alone time is important to keep yourself feeling fresh. Ask a friend or a neighbor to stay with your loved one just so you can take some time to grab a coffee or simply go for a walk. Tip number 2. Use respite care. Every once in a while, you will need more than a few hours to yourself. One option for this is to ask a relative or a friend to come stay with your loved one for a few days. If this is not an option, there are assisted living and other senior facilities where seniors can stay a few days at a time. Use this time to vacation or take a longer getaway to get necessary rest and relaxation. Tip number 3. Find a support group. Being a caregiver to a person with Alzheimer's or dementia can be isolating. Having a good support group of people who are in the same situation can reduce the isolation and ease the burden. Tip number 4. Identify caregiver burnout. If you have any of the following symptoms, seek help from a mental health professional. Feeling overwhelmed, feeling depressed or extreme sadness, unable to function as you used to, yelling at the person you are caring for or excessive crying, staying up at night worrying, loss of appetite, weight loss, feelings of isolation, abusing alcohol or drugs, feeling hopeless, suicidal. And lastly, tip number 5, enjoy the little things.